shoulder labrum, aka the glenoid labrum, which gets kind of confusing. This is essentially the same thing when you see physicians, orthopedic surgeons talking about these things. So just understand that these are used kind of interchangeably. And it's probably important to note that if you just say labrum, that's not specific enough. You just say labral tear. Well, you've got labral tissue in your hip as well, and it functions very similarly to the shoulder, but you want to make a clear distinction between the two when you're just saying, hey, labral tear, because I've actually had patients in my office that have both at the same time. So that does happen. So again, shoulder anatomy, referencing back and giving you an idea of where we're at. So right here, you can see that glenoid, and we say glenoid labrum, which is the rim of tissue around. So we'll define that for you here in just a second, but again, I wanted to show you that anatomy. This ring of tissue right here is what that is, and I've got here, it's a good way to see a three-dimensional understanding of how that ring sits around that arm bone. All right, so what is the labrum? It's a ring of fibrocartilage around the edge of the articular surface of the bone. It basically increases the surface contact area to help stabilize the joint. So you can imagine you've got this nice surface that's smooth and it can support and hold that in. So when you dislocate, right, it's one of the things that resists a dislocation of the shoulder. So if you have a tear, sometimes that comes secondary to a dislocation or something, you've hit your arm, or you've thrown too hard, or you've maybe been in a car accident and you were holding the steering wheel. All of those things can cause tearing in that tissue.